Hello guys, welcome to today's edition of Gross Anatomy. So today we're going to be talking about the lumbosacral plexus. So the lumbosacral plexus is a combination of the lumbar plexus and the sacral plexus. Alright, so when we look at the term plexus, what does this mean? It means that it's a collection of nerve, alright, like T12, L1, L2, L3. When these all come together, it becomes plexus, just like we have the brachial plexus. All right. So the lumbar plexus, it comes from the anterior or ventral rami of the spinal cord, the L1. So the nerve roots, L1, L2, L3, L4. So the lumbar plexus is from the anterior or ventral rami of L1, L2, L3, and L4. And then we have the sacral plexus. But the sacral plexus is usually, they contain the pudendal nerve and stuff like that. They are usually nerve fibers, nerve which goes into the gluteal region. So when we talk about the lower limb, so the lumbosacral plexus, this provides sensation to the lower limb. All right. So just like I do here. But let's start. How do I go about this? All right. So first of all, you start by writing your T12, L1, L2, L3, all the way to S4. After you write down these ones, then you draw horizontal lines for each one of them, all the way from T12 to S4. Remember, T12 is the subcostal. It's not part of the lumbosacral plexus. The only reason why I added it is because the genitofemoral nerve receives from T12. That's why it's being included here. But when you talk about the lumbosacral plexus, subcostal nerve is not part of it. All right. Okay. So let's look at genitofemoral nerve. So genitofemoral nerve is receiving from T12 and L1. And then we come to L1. We realize that L1 will give off two branches. All right. So for L1, we have the iliohypogastric, and then we have the ilioinguinal. All right. Then L2, L3, we have the lateral femoral cutaneous nerve. L2, L3, lateral femoral cutaneous nerve. L3, L4, we have the femoral nerve. From here, we have the sacral plexus. All right. So the lumbar plexus go from L1 to L4, and then the sacral plexus will go from L5 to S3. Okay. All right. So let's see. So over here we have L4 and S1, which is for superior gluteal. How can you remember this? We have a mnemonic called SIPS. SIPPS. All right. So the SIPS, the first S is for superior gluteal nerve, the I is for inferior gluteal, P is for posterior femoral cutaneous nerve, and this P is for pudendal nerve. And then we have the sciatic nerve. All right. Look at the sciatic nerve. It goes all the way from L4, L5, S1, S2, S3. Guess what? It is the biggest nerve in the human body. So every time you are doing lab or when you are doing the practical, and then they tag a nerve which looks like really, really big, right there you know you are looking at the sciatic nerve. It's actually really, really big. Very big. So the sciatic nerve gives off two branches. We have the common fibular nerve and the tibial nerve. All right. So what are the two terminal branches of the lumbosacral plexus? We have two terminal branches coming off anteriorly, and we have two coming off posteriorly. So what are the two anterior terminal branches? We have the tibial nerve and the obturator nerve, which is written here. So for the terminal branches of the lumbosacral plexus, for anteriorly, we have the obturator nerve and the tibial nerve. And posteriorly, we have the femoral nerve and the common fibular nerve. So these are the terminal branches. So over here we have the obturator. So the obturator nerve is L1, L2, L3, which is why I connected it to the L1 here. Guys, if you are able to draw this out before the exam, you can get simple questions right. Because on the exam they can ask you, what are the nerve roots for the sciatic nerve? If you've already draw this one, you can write there, you can figure it out. It's like L4 to S3. So 1, 2, 3, 4, 5. If they ask for obturator nerve and you've not been able to memorize it, if you're able to draw, you know it's L1, L2, L3. Alright? So it makes life easier. So this is the anterior leg and this is the posterior leg. I know my drawing sucks, alright? But I tried. Alright, so let's see. So this is the lateral side of the leg, this is the medial side of the leg. Alright, let me stand on this side. Now let's look at the thigh region. So on the lateral side of the anterior thigh region, we have the lateral femoral cutaneous nerve. Every time you hear the word cutaneous, it means sensory. Alright, most of the time, all these nerves, they either provide sensory and motor, or sensory or motor. When it comes to cutaneous nerves, it only provides sensory sensations. Alright, so every time you see the word cutaneous, like lateral femoral cutaneous nerve, it's only sensory. Posterior femoral cutaneous is only sensory. Alright, okay. So on the lateral side of the anterior thigh, we have the lateral femoral cutaneous nerve. On the anterior surface of the anterior thigh, we have the femoral nerve. So the femoral nerve, when it comes into the leg on the anterior surface, on the anterior surface, we call it the saphenous nerve. The saphenous nerve. So the saphenous nerve is just the femoral nerve in the lower X arm on the leg. Alright. So the obturator nerve is found on the medial side. So the obturator nerve provides motor and sensory sensation on the medial side of the thigh, as we see here. So on the lateral side, we have the lateral femoral cutaneous. So it goes all the way to the knee for the lateral femoral cutaneous. But for the obturator nerve on the anterior and the posterior sides, they provide sensation on the anterior and the posterior sides of the medial thigh. And then on the posterior side of the thigh, we have the posterior femoral cutaneous, which is right here. Posterior femoral cutaneous provides sensation to the posterior side of the thigh. Alright, we have our genitofemoral nerve. Alright, so the genitofemoral nerve is a combination of genitals and femoral. Alright, so they provide sensation to our genital area. So for males, we can provide sensation to like cremaster muscle. Cremaster muscle, I don't want to talk about cremaster muscle. And we have the labia majora, which is a genital, which can be supplied by the genitofemoral. And the femoral part is like the anteromedial part of the thigh region provides sensation. So the genitofemoral nerve provides sensation to the anteromedial side of the thigh and also the genital area. We have the iliohypogastric and the ilioinguinal. Remember both of them L1. Alright. So actually iliohypogastric, when you see it, look for the transversus abdominis, because usually it pierces into the transversus abdominis muscle. So what does it supply? So it also provides, despite the fact that it provides sensation to the anteromedial surface of the thigh, both the iliohypogastric and the ilioinguinal provide motor sensations to the internal oblique muscle and the transversus abdominis muscle. Alright. The reason why I haven't included the gluteal region, the superior and the inferior gluteal, because this provides sensations to the gluteal region. So it's not so hard. As long as you are able to draw and visualize it on the exam, you should be able to get most of the questions right. So on the exam, they can ask you a question like, a 22-year-old man presents into your clinic complaining of pains on the medial side of his thigh region. And then the question stem can also say that, so which of the following is responsible for providing innervation to the medial side of the thigh? And the answer will be obturator nerve. All right. How about a patient presents into your clinic and the patient is complaining of pains, or no, not pains, some tingling sensation on the lateral side of the anterior thigh? Which nerve is responsible for providing sensation? Lateral, femoral, cutaneous. If the patient comes and the patient is complaining of tingling feelings on the posterior surface of the thigh, which nerve? Posterior, femoral, cutaneous nerve